Okay, I'm going to go ahead and kick us off. I'm going to start with some introductions. My name is Joy Harris. I'm the Director of Education Services at PHAB. I'm excited to be here with you today. I'm with Amanda and Lydia. Amanda, do you want to introduce yourself?
Yeah, hi everyone, good morning. Thanks again for joining us today. I'm the education specialist here at PHAB, and I've been here for about a year, and I am very happy to be here with you today. Back to Joy.
And then Lydia is here if you have any technical questions, assistance. Do you want to introduce yourself, Lydia?
Yeah, hi everyone. I'm Lydia. I'm a program assistant at PHAB. I've been here for about a year as well, like Amanda, and here if you need anything, any tech issues.
Thank you. Okay, so now you know us. We would love to know who's here. If you wouldn't mind putting your name and where you're from in the chat, that would be awesome. We're here to talk today about vital records and health statistics accreditation. We're going to talk a little bit about how it aligns with the infrastructure grant and how we think state health departments and vital records departments can work together to approach accreditation. Please feel free to chat us a question. You're able to turn on the closed captioning if you need that. We really want you to get what you need out of this, so please stop us if you have a question and don't hesitate to chat it in. I think that's it for logistics. Amanda's going to help monitor the chat, and I'm going to do the talking. I apologize, I'm getting over a cold, so hopefully my voice isn't too bad. Here we go. So we are talking about vital records and health statistics accreditation as we really feel like it's a good alignment with the data modernization strategy of the infrastructure grant. And we're going to talk about why as we go through. But as you all know, I'm sure vital records is a very important data source for a lot of things public health related. And so we really think that link with data modernization is strong. I also feel like we can make an argument for VRHS. I just saw it in the chat. We will be sharing the presentation after the session, as well as any additional resources that kind of come up as we go through the chat today. Thank you for asking that. I'm sorry I didn't say that up front. Okay, we also feel like vital records and health statistics accreditation could really also fall in the foundational capabilities, especially as you look at assessment and surveillance, organizational competencies, and policy development and support. So let's start with why we're talking about VRHS accreditation and what are the anticipated benefits. So we are really looking at how standards can ensure consistency across the country with vital records and health statistics. We feel like accreditation for VRHS, just like health departments, really leads to a lot of opportunities for quality improvement. It's a chance to look at what you're doing, think about how you could do it differently, perhaps, and really work towards those best practices. We can, and we have seen it, improve the visibility and image of the VRHS unit, just people having greater understanding of what it is, working together with the health department through this process. And then finally, that standardization and modernization of VRHS functions nationwide. So these are the things we are seeing and hope to see more of as this program grows. As we think about the principles of the standards and measures, here's what we were looking to do when we set out this program. So first, we wanted to advance public health practice, including the legal and administrative functions of the VRHS units. We really wanted the standards and measures to be reasonable and attainable, but we knew in some cases there might be a little bit of stretch with what the measures would entail. We wanted clear performance standards. We wanted to really make sure we were avoiding any redundancy and any unnecessary documentation. We've learned a lot through developing health department accreditation, and we did our best to apply those lessons, but we continue to look at how we can improve the standards and measures. And then finally, also, we wanted to be sure that we were reflecting emerging VRHS issues and opportunities. There have been a lot of changes in how VRHS departments are working, new technology, security coming their way. So we want to be sure that our standards and measures stay current. I wanted to answer the cost question up front. So the cost for VRHS accreditation is $4,100. It's an annual fee. It doesn't matter where you're at in the accreditation process. It will be that number. That pays for the support that you get for PHAB, ePHAB access, which is our documentation collection system. And so that is how we're moving to VRHS accreditation. This is new. It used to be a little bit different. So wanted to be sure that you knew about that. We wanted to show you who is accredited. There are 5 vital records and health statistics departments accredited across the country. So Arizona, Wyoming, South Dakota, Iowa, and Florida. We are super excited to have them, and some of them are starting to get ready for reaccreditation. So that's exciting too. I want to walk through the steps for VRHS accreditation. They are incredibly similar to health department accreditation. And so that really helps you think about perhaps how you could work together through this process. So it starts with preparation. Preparation leads to registration and application. Then you submit your documentation. There's a review of that documentation, an in-person site visit, a decision by our accrediting board. If you are accredited, then you do the annual reporting process, and reaccreditation happens at 5 years. So let's take a little look more at what each of those means. So with preparation, some of the key steps are first, you need a VRHS accreditation coordinator. The accreditation coordinator's role is to really organize the unit's work around accreditation. You need someone who's able to kind of facilitate the meetings, pull things together, set the agenda. This person is also the contact with PHAB. So if there's any questions between the VRHS unit and PHAB, it should go through that accreditation coordinator. It's also important during this preparation phase that you review the standards and measures so you have a good idea of what is being required. That can help you know when you want to go ahead with registration and application. There is orientation and training that you can do with PHAB that you're required to do in order to submit an application for VRHS accreditation. That is different from health department accreditation. Right now, we do that training annually at the NAPSIS annual conference, but we're looking at how we can provide that at least 2 times a year, one maybe being virtual. And then finally, we really recommend a self-assessment. It's not required, but it is a really helpful way to start looking at how your unit is meeting standards and measures. Our big tip is as you go through that, take really detailed notes so that you think about what you have, maybe where you might go to get that documentation. That will just save you time in the long run so you don't have to have those conversations again. The next phase is registration and application. So it's important to note that you can register with PHAB, but it doesn't commit you to moving forward with the VRHS unit process. So what's kind of where you commit is with the application. And the application doesn't take long to fill out, but it's submitted in ePHAB. And that then is their formal agreement to complete the accreditation process. We send you an invoice for the application fee. That's paid. And then we give you access to ePHAB and it all begins. This is the link to the getting started page for the registration application for VRHS unit. So you'll have that when you get the slides. With the next step, it's documentation selection and submission. So with this step, some people choose to start kind of back in that preparation phase. Some people wait until after application. There's no right way. It's what works for your department. So your first job is really to gather or create any documents that you need to be able to supply to PHAB as documentation. You're going to want to look at those documents with a critical eye to see if they meet the standards and measures, if they're understandable by folks outside of your unit, and select the documents that you want to move forward. Sometimes you're going to have a lot of choices, and so you might want to think about what are the best things for me to put forward. We're going to ask that you complete documentation forms. So the documentation forms are really your opportunity to tell the site visit team exactly where you want them to look in your documentation so that we make it easy for them. We like to make it easy for them because that helps you and them. Also in that documentation form, you're able to provide any context or any additional information that you want to provide to the site visit team. Once you've completed all those documentation forms, you're going to submit that documentation to PHAB, and a completeness review is going to happen. The completeness review is going to look at things like, is your documentation dated? Is it authenticated? Is something missing? Is something upside down, hard to read? So that will be the first review, and you'll get that completeness review report from PHAB asking you to fix those things or provide different examples. As you think about documentation, I wanted to just give you some general guidance so you have an idea. Again, it's not that different from health department accreditation as you think about the kinds of documentation that you would need to submit. One of our rules is it should be current and in use when submitted. So you want to make sure that the policies, procedures, and plans that you're submitting are current to that practice. PHAB does not accept draft documents. Those draft documents are considered incomplete. Another thing to think about with draft documents is unsigned documents. Those also are not allowed. We don't want any confidential information, so please redact what you need to and think about that as you think about documentation. It is a paperless process. Anything that you want to submit is going to need to be electronic, and it's going to need to be in PDF. Sometimes that takes a little work with maybe scanning some things. We're going to ask that you use those documentation forms that I talked about earlier. And putting documents in PDF is sometimes, it can be time consuming to make things from Word or Google into PDFs. But that is the kind of document that our EFAB system will accept. Oh, yeah, Amanda.
There was a question in the chat that says, do you recommend that this accreditation coordinator is the same person who is the health department's accreditation coordinator if their department is already accredited?
Some departments have chosen to go that way. Other departments have chosen to go with a separate accreditation coordinator for VRHS. It's completely up to you. Before PHAB, I came from the Iowa Department of Public Health, where I was the health department state accreditation coordinator, and I worked closely with the VRHS accreditation coordinator as they went through the process. We really worked together, and I thought that worked well, but I do know that some places it is the same person. So I think it's what works for you. That's not a very straight answer. Sorry. So, okay. Also with documentation, thank you for the question, by the way. Also with documentation, you really want to think about what is in place, not how it got there or who developed it. Sometimes we find that folks, as they think about documentation, are thinking more about that how and who. But what we really want to know is what is happening. Documentation could be developed from a lot of different partners. So it could come directly from the VRHS unit. It could come from the larger state health department. Maybe when you think about a continuity of operations plan or orientation of new employees. It can come from another level of government or a separate government agency. It can be a community partner or nonprofit that you work with. It could be some kind of contractor providing that documentation or through partnership. So not all of the documentation is going to come from the VRHS unit, and we don't expect it to. What you're going to want to do, though, if documentation isn't from your VRHS unit, is be able to explain your relationship with the body that is providing the documentation that you use. So that's kind of the key there when it's documentation outside of your unit. But please know it doesn't all have to come from the VRHS unit. Next, we have the site visit. So the site visit team is going to be assigned, and they're going to do a pre-site visit review. So they're going to review all of your documentation. There are going to be people with vital records and health statistics backgrounds on your site visit team, as well as a PHAB accreditation specialist. And that site visit team is going to really conduct that pre-site visit review. So through that process, they're looking at all of your documentation. They're recording what questions they have, and will probably ask you for additional information where they have questions. When that happens, we call that measures being reopened. So if that measure is reopened, you'll have the opportunity to provide additional documentation to PHAB about how you meet that measure. The site visit is in person with vital records and health statistics departments. It really helps to see kind of confidentiality, how things are laid out as we think about some of the requirements of the standards and measures. Once that site visit is completed, a site visit report is going to be drafted. That site visit report is going to record kind of strengths and opportunities of the VRHS unit. There will be assessments of each measure with how you meet and maybe what's missing, if there's anything missing from the standards and measures, and also conformity statements that really talk about what you provided. Very similar, again, to what happens with health department accreditation. Really briefly wanted to cover the scoring scale. So for vital records and health statistics, like health departments, this is the scale that we use to score adherence to the measures. So not demonstrated, slightly demonstrated, largely demonstrated, and fully demonstrated. You do not have to largely and fully demonstrate everything to be accredited. We get that question a lot, so I want to be sure that we mention that. But this is the scoring scale that we're using for VRHS accreditation. The accreditation decision happens by PHAB's accreditation committee. This is a group that meets quarterly, and they review the site visit report. They don't review any of your documentation, but really just look at that report to make their decision about accreditation status. At that point, you can be accredited for a period of 5 years, or you could receive an accreditation committee action requirements, or an ACAR. And with the ACAR process, the accreditation committee is going to identify measures they want you to work on a little bit more and provide additional information to PHAB. So I wanted to talk a little bit about the ACAR process. It is part of the accreditation process. It is measures that need additional work. What happens is you're going to implement the improvements that you want to make. You'll have 6 months to provide updated documentation to PHAB. Your same site visit team is going to review that documentation, assess the documentation, again, write another report, an updated report, and send it to the accreditation committee. At that point, the accreditation committee will either decide that you're accredited or not accredited. So that's how the ACAR process works. And then once you're accredited, we do have an annual report process. So the annual report is submitted each year on the anniversary of when you were accredited. We provide all the forms and requirements that you need to go through that process. And the annual report is really meant to help continue the work of accreditation moving forward, help you think about ways that you might implement changes that you want to make, incorporate quality improvement into your work, those kinds of things. Reaccreditation happens after 5 years. So we have our first couple of vital records departments starting to approach reaccreditation. You have to apply for reaccreditation or your accreditation status can expire. And we have new reaccreditation measures. We hadn't needed them yet. So they are brand new. They have been approved by the PHAB board and they'll go into effect the first of the year. So we are excited to have those in place. And we had a great group of VRHS professionals, subject matter experts helping us develop those measures. Wanted you to have kind of a cheat sheet for the time frames that we talk about with the accreditation process. The big change from health department accreditation is that registration and application have to happen with the training that starts first, where it's a little different with health department accreditation. So this is here for you if you need it. Okay, before I jump into the standards and measures, I want to take a drink really quick. But any questions that you all have, please feel free to put those in the chat. We'll give it 30 seconds. Okay, I didn't see anything, so I'm going to keep going. Thank you for the opportunity to get a drink of water. All right, so one, I think, really big difference between health department accreditation and VRHS accreditation is that we have 7 topic areas versus the 10 domains with health department accreditation. These are the topic areas. You can see how they relate specifically to VRHS units. So registration, security, issuance, data collection, transmission and reporting, reporting statistical data, and administration and management of the vital records and health statistics unit. We're going to look at some examples. I think that they help to think about where health departments and vital records folks have things in common, and also look at some of the things that are different between the two standards and measures. So this is standard 3.1, issue certified copies of vital records. The purpose of the measure is really important to look at. I find that people oftentimes skip over this, but that purpose is really important in understanding what the measure is trying to get to, so why it's important for accreditation. So here we're trying to assess the unit's attention to optimal customer service when issuing vital records. Similar to health department accreditation, there is required documentation, guidance, the number of examples, and that dated within column. Again, our accreditation period is 5 years. However, there may be requirements for shorter periods of time like this, where we anticipate that things will be reviewed on a more frequent basis. So required documentation 1, or RD1, as sometimes you'll hear us talk about it, is processing requests for certified copies of live birth and death records in a timely manner. In the guidance section, it's going to tell you more about what it takes to meet that requirement. So you must provide an annual report that documents the issuance of certified copies of live birth and death records in a timely manner. And then here you can see the timeliness definition of 5 business days within the guidance. The guidance really in the VRHS standards and measures is a little bit different than the guidance for health department accreditation, where more of that is in the required documentation column. So you really need to look at the required documentation and guidance section with these standards and measures to look at those requirements. You can see we need 1 annual report and it needs to be dated within 1 year. Another thing I want to point out is the required documentation 3, use of customer feedback for quality and performance improvement. So this is one where we often see a lot of work between health departments and vital records and health statistics to think about how they get that customer feedback and how that informs quality improvement. Another one to give you kind of some food for thought. So this is measure 6.1.1 about a competent VRHS workforce. You can see there's 3 sub-requirements. So recruitment and retention of employees. So this plan needs to be specifically about VRHS employees. However, it may be part of the larger department plan. It also includes new employee orientation. So here you can talk about orientation maybe done by your department, but then there also needs to be some specific orientation related to the VRHS unit. So documentation could be a combination of both. And then finally, that performance assessment of employees. It's how do you assess the employees? A lot of folks sometimes comes from the overall health department performance review process or another area of government. Here's the next one, 7.13. So fiduciary oversight of fee development, processing, and maintenance. There's 2 requirements, fee development and management of fees, and then formal efforts to seek resources to support the vital records, health statistics infrastructure. Again, similar to health department accreditation, really looking for how you handle fees, how that appears in the audit, and then also looking for resources to support vital records. You can see examples of what the documentation could be. For example, memos, emails, testimony, and reports. Could be, and for example, are really important words I want to call your attention to. This doesn't mean it has to be one of those things. It could be, and for example, we oftentimes find folks get caught and then it has to be one of those things. So really watch for words and phrases like that. And then here, measure 7.1.4, collaboration with other health department staff. So this really gets to how the VRHS unit and the health department work together. So regular and consistent collaboration with administrative and program staff in the department. So what does that look like? You can talk about including in meetings, fact sheets, testimony. There's lots of different ways to show that. For 2, engagement with the health department, quality improvement and performance management. So showing that the VRHS unit is part of that larger system. We need 2 examples of that. And then also a quality improvement project. Again, we're looking for 2 examples within the last 2 years. If there's that non-bolded, I'm trying to think of the right word for that, language there at the bottom, that if it's not part of the agency's overall QI and performance management plan, you can still provide those examples and talk about why they were not part of the overall program. Again, hopefully you can see here where the health department and VRHS units can work together. A couple tips for reading measures if you're not familiar with them. Really watch for small but important words and phrases. I wish that we could like bold and underline everywhere it says and or must, could, and for example, to really draw your attention to those things. And my version of standards and measures that I carried around, those words were circled or highlighted, so I made sure to look at them. If you have a question about what your unit does to really get to that purpose, you can just reflect on that and start with that documentation. You are able to reach out to our team of accreditation specialists at Ask PHAB. This is the email address to ask any questions you have about how to interpret the standards and measures. We don't want anyone stewing about what does this mean? What is it asking for? We would much rather you ask, and this is the email address to do that. You can ask about standard interpretation questions as well as process questions this way. And then finally, don't read too much into it. It's really easy to read way more into the standards and measures than they say. It is what it is, and it requires what it requires. And so if you can kind of help yourself not get too deep down the rabbit hole as you're reading those standards and measures, that could be really helpful. This was another place where I and the VRHS unit accreditation coordinator were able to help each other because we could both see when the other was maybe thinking about something a little too hard. So you can help each other out that way. Wanted to talk really quickly about our reaccreditation policy and standards and measures. So we're calling those version 2024. They go into effect January 1st of 2025. We had 5 goals in establishing those reaccreditation standards and measures. They're reflecting current aspirations with reasonable expectations, intent over documentation, really looking at whether or not we're meeting that purpose, accountability and confidence. We wanted to clarify any requirements, and then strengthen synergies between VRHS units and state and territorial health departments. Those will be available on the PHAB and the NAPSIS websites. NAPSIS is very active in VRHS accreditation, providing technical assistance, and a lot of resources on their website for vital records and health statistics programs going through accreditation. And again, if you have any questions about the reaccreditation standards and measures, you can reach out to Ask PHAB. Okay. I want to take a step back now and talk about what is the same between health department accreditation and VRHS accreditation. We've talked about some of these, but just want to take a minute to call them out specifically. So first, documentation is required, right, to prove that you meet the standards and measures. And so the process for looking for documentation, determining what's the best documentation, you can use a very similar system as well as organizing documentation. Both require the role of the accreditation coordinator. As I said earlier, it could be the same accreditation coordinator, it could be different. It's whatever works for you all. Having an accreditation team is going to be important. This should not be the work of an individual. We want a team of folks to help kind of gather documentation, look at documentation, and be able to describe the work of a VRHS unit. You also, like health department accreditation, need leadership support and need to be able to talk about that in your application. The format of the standards and measures is largely the same. I tried to point out a few of the differences, but I feel like if you are comfortable reading health department standards and measures, you're going to be comfortable reading VRHS, and the opposite is true as well. As with health department accreditation, one of the huge things that we have to think about is all documents have to be authenticated and dated. Authentication meaning that it belongs to your unit or that it belongs to a partner that you're working with. We need to know who that document belongs to and then what your relationship is with that group is the short version of authentication. And then with dating of documents, we really recommend that documents are dated with a month and a year as much as possible. That just makes things a little easier as we think about some of those accreditation timeframes. If there's just a year on it, it can be really difficult to tell how old a document is. Just like with health department documentation, if documentation isn't authenticated or dated, PHAB will turn it right back to the VRHS unit and ask that new examples be uploaded. We also have the cover sheets and documentation forms. They're very similar. They look pretty much the same, where you provide that context and information about the documentation being submitted. Our documentation forms for VRHS units are on the NAPSIS website. You also have similar PHAB support. So you have an accreditation specialist team with Ask PHAB. As you submit your documentation, an accreditation specialist will be named for you. And those accreditation specialists are really, they're really wonderful. And they really want to help your department succeed. So they're there to answer your questions, facilitate the meetings, help you develop that schedule for the site visit. And they're going to be with you the entire way through the process. Quality improvement and the requirements around quality improvement are the same. And so that can be a really great place for departments and units to work together. The pre-site visit review process is very similar, and that site visit process, the kinds of things to be prepared for, what it can look like, is also very similar between VRHS units and departments. As we think about ways to help each other, here are some things that really we have seen and that speak to us as we talk about this and think about this. First of all, there is the opportunity to share documentation. In some cases, you both need to be able to provide the same documentation. Examples are the COOP, the continuity of operations plan, any information technology, system security, customer satisfaction. Those are required in both areas. Oftentimes you can share that documentation, share the documentation form, or really develop that together. I think another way that you can really help is to help interpret the standards and measures. Sometimes when you are in it, and it's hard sometimes to look at your work from that outside perspective. So having someone maybe from the health department with the VRHS unit and opposite as well, to really think through what are the standards and measures asking of us. In my department, it was a great way to offer outside perspective on documents. I didn't know anything about vital records and health statistics going into this process, but I learned a lot. But it also gave me the ability to ask questions, and then for them to think about if something was clear, could be clearer, or needed to be included. So that was a really positive thing. We were able to also use VRHS folks to help look at department accreditation materials as well. Can help review documentation forms. Do they make sense? Do they tell the site visitor where to look? Is the context available? Are you relying too much on the documentation form? They can really help with that. And then finally, I think be each other's cheerleader as you go through the process. You have two different accreditation teams potentially, two different accreditation coordinators, but you can really do a lot to support each other because you know what the other person is going through as well. So these are ways we think you could really help each other through the process. Okay, so I want to come back to VRHS accreditation and the infrastructure grant and data modernization. So hopefully you're starting to see how work on VRHS accreditation could fall in this data modernization strategy, as well as with the foundational capabilities. So I did a little reading about the data modernization initiative as I was preparing this. And to me, it really spoke to why it's so important that vital records perhaps be considered as part of this. So the goal of the data modernization initiative is to get better, faster, actionable insights for decision making at all levels of public health. And you can see there the vision, right? One public health community that can engage robustly with healthcare, communicate meaningfully with the public, improve health equity, and have the means to protect and promote health. The link here is to that space on the CDC website about the data modernization initiative. Vital records data very clearly plays into that. If you're not familiar with vital records data, it tells us a lot of things. I've come up with a list of a few things that we use VRHS data for: birth rates, preterm birth, teenage pregnancy rates. Can be helpful in identifying infant mortality, causes of death, information about life expectancy, marriage and divorce statistics. In Iowa, where I come from, it's a big news day when the top baby names from last year come out. So these are different things that VRHS units can provide data to. And that data is really important and help us understanding our community in public health, specific populations, and just moving the work of public health forward. So here are the 5 priorities and objectives from CDC's Data Modernization Initiative. So building the right foundation, accelerating data into action, state-of-the-art workforce, support and extend partnerships, manage change and governance to support new ways of thinking and working. One of the things that we've done, and we're not able to publish it yet, but we're working towards that, is do a crosswalk of where the accreditation and reaccreditation standards and measures for vital records departments fit within these priority areas. And we're going to look at a couple of those. So first, under priority 1 of building the right foundations, you can see there's a column here for initial accreditation and reaccreditation. And we call out those specific measures that we think align. So timely vital records data, you can see how that would fit under transforming legacy public health data systems and activities, enhancements as part of reaccreditation, and that updates, enhancements, or replacement is also part of reaccreditation. In priority 2, we talk about develop, aligning, testing, implement data standards to increase interoperability. You can see in both initial accreditation and reaccreditation, there are several measures that get to that priority. The one that really jumped out to me is that maintain data quality assurance processes through data quality feedback loops. And then what is that data quality assurance process as I was reading this through? Under priority 3, increase the data science capacity and capabilities of the workforce. There are several requirements around the workforce for VRHS units. So we want to make sure that they're qualified and diverse. We want to make sure that our training provided to local registrars gives them the information that they need. And then there are requirements around leadership and supervision of vital records and health statistics because they are so important. We want to be sure we have those things in place. And then finally, priority 4, support and extend partnerships, establish public health policies that support exchange and use of data between CDC, the state, local, tribal, territorial partners, and data providers. So here we can see the annual and other vital statistics summaries, the procedures for participating in the national system, examples of how VRHS falls under that data modernization priority. It's my last one. Govern data and IT policies, planning and resources to align with shared vision for modernization, and evaluating data modernization initiative activities and projects to ensure accountability and continuous program improvement. This really gets to quality improvement, performance management requirements of the health department accreditation, VRHS unit accreditation, and with the IT system security, we're looking at both of those things in health department and VRHS accreditation. So that, I was hoping to leave about 15 minutes, so I did pretty well. Leads to kind of questions and answers that we can answer about VRHS accreditation. I'm going to stop sharing my screen about how health departments can work together. And so just wanted to leave some space for questions. Please feel free to put them in the chat. See the note about our accreditation specialists. Yes, the accreditation specialists are incredibly valuable to the process. They provide a lot of good insight and work really hard to be consistent across the team. And so they're both supportive of health department accreditation and VRHS accreditation. And they're great if you have questions and ask FAB. Waiting, the other thing I would say about my experience in Iowa was that it was a great way for the state health department was accredited first, and it was a great way for us to take the lessons we had learned about where to have site visitors look and kind of how to fill out those documentation forms so that we could so VRHS unit could hopefully answer a few less questions because they learned from what we learned. So I really think that working together is good. I see the question about templates and working examples. So NAPSIS is the group working on developing those templates and working examples for VRHS units. And those are available on their website. They have a special portal for VRHS units with these accreditation resources. don't come from PHAB. You're welcome. Yeah, okay. Training's offering twice a year, a timeline for that. So we just provided training in May at the NAPSIS annual meeting, and we're looking at providing training after the first of the year virtually. That's really vague. But January, February-ish, I think is the first time that we are going to provide that training virtually, because we know it can be expensive to come to the NAPSIS annual meeting. And so we're hoping this will make it more accessible for folks. Those dates will be available from both PHAB and our newsletters, as well as NAPSIS, about when those trainings are going to be. It's a 4-hour training to really get you kicked off with accreditation. Yeah. Thanks for the question. Starting point is EFAB. Yes, so you'll have that link in the slides, but you're going to register an EFAB, and that will start that process off for your department, for your unit. That'll help us get you in all the training and what you need to get started. And if you have any questions about starting, reach out to that Ask PHAB address as well. Cool. Well, not seeing any more questions and kind of closing thoughts. Thank you for being with us today. I hope that you understand a little bit more about VRHS accreditation, its link with data modernization and the foundational capabilities, and are thinking about how you can work together between VRHS units and state departments. I do think there is a lot of benefit in working together and raising the visibility of VRHS units. And with health departments, it can be a really cool opportunity to learn more about each other and work together. So I hope that you'll think about that as you proceed. All right. Well, we're going to let you go. Thank you so much for your time and attention. Lydia put the link to the evaluation in the chat. We'll also include that in the email that comes after this with the slides. And we would really appreciate you completing that evaluation so we can continue to make our training better. So thank you so much. I hope you all have a great day and let us know if you need anything. All right. Thank you, everybody. Bye.